Good morning, students. So, we were talking about alcohol and drug abuse. The second factor associated with alcohol and drug abuse is addiction and its dependence. Drugs are normally used as medicines to help the patients cope with the illness. But when these drugs are taken for purpose other than the normal clinical use, it is abuse or addiction. Drugs are frequently used. The most important thing which one fails to realize is the inherent addictive nature of alcohol and drugs. That is, one becomes dependent on this habit. Addiction is the psychological attachment to certain effects such as euphoria, temporary feeling of well being associated with drugs and alcohol. This forces people to take them even if they are not needed or even when their use becomes self destructive. With repeated use of drugs, the tolerance level of the receptor in our body increases. Secondly, the receptors respond only to higher doses of the drugs or alcohol, leading to greater intake. The use of these drugs, even once, can be forerunner to addiction. Thus, the addictive potential of drugs and alcohol pull the user to vicious circle leading to their regular use, that is abuse, which she or he may not be able to get out. A person who is habituated to a substance or a drug is known as addict. Addiction is a habitual, physiological, and psychological dependence on a substance or practice which is beyond voluntary control. In absence of any guidance or counseling, the person gets addicted and becomes dependent on the use of the drug. Dependence is the tendency of the body to manifest a characteristic and unpleasant withdrawal syndrome if a regular dose of drug or alcohol is suddenly discontinued. This is characterized by anxiety, shakiness, nausea, sweating. This may be relieved when use is resumed again. In some cases, withdrawal symptoms can be severe and even life threatening. The person may need medical supervision. Dependence lead the patient to ignore all social norms in order to get sufficient funds to satiate his or her needs. This results in many social adjustment problems. More often, it leads to several crimes like stealing, robbery, domestic violence, depression, deteriorating relationship with family and friends, serious infections like AIDS and hepatitis B, etc. Adverse effects of drugs and alcohol include reckless behavior, vandalism, and violence. Excessive doses may lead to coma and death due to respiratory failure, heart failure, cerebral hemorrhage. A combination of drugs or their intake along with alcohol generally results in overdosing and even cause death. The most common warning sign of drug and alcohol abuse among youth include drop in academic performance, unexplained absence from school college, lack of interest in personal hygiene, withdrawal, isolation, depression, fatigue, aggressive and rebellious behavior, loss of interest in hobbies, change in sleeping and eating habits, fluctuation in weight, appetite, etc. There may be even some far reaching complications of drug or alcohol abuse. If an abuser is unable to get money to buy drugs, alcohol, he or she may turn to stealing. Adverse effects are just not restricted to a person who is using drugs or alcohol. At times, a drug or alcohol addict become the cause of mental and financial distress to his or her entire family and their friends. Drugs or alcohol abuse makes the person unfit for the society. Those who take drugs intravenously, that is, injection into the vein using a needle or syringe, are much more likely to acquire serious infections like AIDS and hepatitis B, which occurs due to sharing the needle. The viruses which are responsible for these diseases are transferred from one to another by sharing the needles and syringes which are infected. Both AIDS and hepatitis B infections are chronic and ultimately fatal. Both can be transmitted through sexual contact or infected blood. Use of alcohol during adolescence may have long term effects. It could lead to heavy drinking in adulthood. The chronic use of disease alcohol damages nervous system and causes liver cirrhosis. The use of drugs and alcohol during pregnancy is also known to adversely affect the fetus. Another misuse of drugs is what certain sportsmen do to enhance their performance. The use, or we can say misuse, narcotic analgesics, anabolic steroids, diuretics, and certain hormones in sports to increase muscle strength as well as muscle bulk to promote aggressiveness, which ultimately results in high athletic performance. The side effects of the use of such steroids in females include masculinization, that is, features develop like males, increased aggressiveness, mood swings, depression, abnormal menstrual cycles, excessive hair growth on the face and body, enlargement of clitoris, deepening of voice. In males, it include acne, increased aggressiveness, mood swings, depression, reduction of size of testicles, decreased sperm production, potential for kidney and liver dysfunction, breast enlargement, premature baldness, enlargement of prostate glands. These effects may be permanent with prolonged use. In the adolescent male or female, severe facial and body acne and premature closure of the growth centers of the long bones may result in stunted growth. Effects of drug and alcohol abuse almost include effect on all the crucial organ system of our body like liver, nervous system, stomach, heart, kidney, etc. Out of these side effects, the age old age of prevention is better than cure holds true here also. It is also true that habits such as smoking, taking drug or alcohol are more likely to be taken up at young age, more during adolescence. Hence, it is best to identify the situation that may push an adolescent towards use of these drugs or alcohol and must take remedial measures well in time. In this regard, parents and teachers have a special responsibility. Parenting that combines with high level of nurturance and consistent discipline has been associated with lower risk of substance abuse. Some of these measures which are mentioned here would be particularly useful for prevention and control of alcohol drug abuse among adolescents. First is avoid undue peer pressure. That is, every child has his or her own choice and personality, which should be respected and nurtured. A child should not be pushed unduly to perform beyond his or her threshold limits, be it studies, sports, or any other activities. Second measure is education and counseling. Education and counseling him or her to face the problems and stress and also to accept disappointments and failures as a part of life. It would be worthwhile to channelize the child's energy into healthy works like sports, reading, music, yoga, and other extracurricular activities. Third measure is seeking help from parents and peers. Help from parents and peers should be sought immediately so that they can guide appropriately and well in time. Help may be even sought from close and trusted friends that are often considered as peers. Besides getting proper advice to sort out their problem, this would help young to vent their feelings of anxiety and guilt. Next measure is for parents and teachers, that is looking for danger signs. Alert parents and teachers need to look for and identify the danger signs discussed above, such as drop in academic performance, unexplained absence from school college, lack of interest in personal hygiene, etc. Even if friends find someone using drugs or alcohol, they should not hesitate to bring this to notice of their parents or teacher in the best interest of the person concerned. Appropriate measures would then be required to diagnose the malady and the underlying causes. This would help in initiating a proper remedial step or treatment and proving oneself to be the true friend of someone. Next is seeking professional and medical help. A lot of help is available in the form of highly qualified psychologists, psychiatrists, and de addiction and rehabilitation programs, which help individuals who have unfortunately got into this abuse. With such help, the affected individual with sufficient efforts and willpower can get rid of this problem completely and lead a perfect life. The centers teaches life skills and drug education, which include decision making, self-discovery, self-esteem, stress management, drug education, anger management, teaching them values, problem-solving tricks, human communication, and time management. So, we, being educated about drug and alcohol abuse, must promote a drug alcohol free life. Say no to drugs and alcohol. Stay safe, stay healthy. With this step, our society will soon become addict free. Our small step can relieve the individual from these evils. So stay alert and keep educating others also.